My name is Satoshi Haginoya, and today we'll be sharing a video tutorial on how to perform continuous non-invasive blood pressure monitoring in dogs and cats. The authors do not have any conflicts of interest to disclose. There are two commonly used types of non-invasive blood pressure monitors, the oscillometric and the Doppler. Both of these techniques can be used to continuously measure the blood pressure, providing data over time and decreasing patient handling. Several things are important to consider to improve the accuracy of these methods. First, the width of the cuff should be 40% of the circumference of the limb in dogs, and 30 to 40% of the circumference of the limb in cats. Ideally, the circumference is measured at the site where the cuff will be placed, and compared to which shows appropriate cuff sizing based on the circumference of the limb. Alternatively, the index line can be held up to the limb to visually estimate whether it covers less than 40% of the limb circumference. A cuff that is too small will falsely elevate the non-invasive blood pressure reading, and a cuff that is too large will falsely decrease the reading. Second, the cuff should be at the level of the right atrium. The location of the right atrium is approximated by the point of the shoulder or thoracic inlet. It is often easiest to have an animal in lateral recumbency to measure blood pressure as long as that positioning does not induce stress in the animal. The most reliable reading from the oscillometric blood pressure machine is the mean arterial pressure. When measuring the oscillometric unit increases and decreases pressure in the cuff to first occlude the artery completely and then detect arterial wall oscillations induced by blood flow as the cuff pressure is released. The maximum arterial wall oscillation measured is the mean arterial pressure. The oscillometric device will then calculate the systolic and diastolic blood pressures based on the measured mean arterial pressure using an internal algorithm. The oscillometric unit can be set to report the blood pressure as often as every 1 minute, providing continuous readings. Because oscillation in the blood vessel wall are caused by blood moving after the heartbeats, the oscillometric unit will report a pulse rate. Always compare the pulse rate to the animal's heart rate. If the heart rate does not match the oscillometric unit's pulse rate, the blood pressure cannot be trusted. Factors that affect the accuracy of oscillometric include the movement of the animal, significant tachy or bradycardia or arrhythmia or hypothermia, and vasoconstriction, vasodilation of the peripheral vessels. The Doppler uses two piezoelectric crystals to detect blood flow through a peripheral artery. The crystal is placed over the side of the artery, distal to the appropriate size pressure cuff. The Doppler emits ultrasonic waves toward the tissue which then reflect back to the probe. These ultrasonic waves are converted on audible arterial sounds. The pressure cuff is connected to a sphygmomanometer manometer which is used to manually inflate the pressure cuff 30 to 40 mm mercury above the point where the audible arterial sounds disappear. Then the cuff is gradually deflated until the audible arterial sounds return. The point at which the first arterial sounds return is called the systolic blood pressure. Studies in anesthetized cats have shown the number obtained by the Doppler is usually lower than the systolic and higher than the mean arterial blood pressure. The Doppler cannot report a diastolic reading. The Doppler can provide pseudo-continuous reading by taping the Doppler transducer on top of the peripheral artery and intermittently manually inflate and deflate the pressure cuff. A helpful trick to secure the transducer to the patient for long-term use is to place the transducer behind the couple or tarsal pad, then wrap the wire through the interstitial space and run to the dorsal aspect of the foot. In smaller patients, Doppler is more reliable as compared with oscillometric blood pressure and may be more likely to provide a reading. Factors that affect the accuracy of Doppler include movement of the animal, significant bradycardia or arrhythmia which make detection of a return of the sounds unreliable, or hypothermia and vasoconstriction, vasodilation of the peripheral vessels. In conclusion, continuous blood pressure readings can be obtained by both oscillometric and Doppler techniques. Understanding the respective advantages and disadvantages of each modality minimizes the chance of inaccurate or inappropriate measurements. Hopefully, this video helps you understand both oscillometric and Doppler techniques for continuous blood pressure readings.